Okay, hello and welcome everyone to our town hall on uniting medical and law students in education and action. This webinar will be a view from providers and lawyers who protect and defend abortion access. AMSA, or American Medical Student Association, is an organization that inspires future physicians who are committed to make the world a better place through medicine. We have a long and luminous history of advocating for healthcare for all and supporting systems of diversity. Our abortion care and reproductive health project exists to support comprehensive reproductive health services, which includes abortion access. We believe that by bolstering medical education, we can create and strengthen future physician leaders, and that is one of the hopes today for this webinar. Please allow me to introduce our wonderful panelist. Dr. Kelly Thibaert is our past AMSA president and chair of the AMSA Foundation Board of Directors and practicing family and ambulatory medicine in Florida. Dr. Kristen Brandy is the Darney Landy Fellow at the American College of Obstetricians and Gynecologists, and immediate past board chair of Physicians for Reproductive Health. Lauren Polk is the Senior Research Counsel for If, When, How, Lawyering for Reproductive Justice, and as author and co-authored Legal Scholarship on Constitutional Standards for Reproductive Rights. Amber Khan is the Senior Counsel, the Lawyering Project, upholding the dignity of people seeking and providing reproductive health care, and is writing on access to health care, immigrant rights, and criminalization of pregnancy, which has appeared in various publications. Thank you so much, and I look forward to hearing from all of you.
Thank you so much, Rohini. And my name is Anna Heineman, and I am a third-year osteopathic medical student at Touro University, California, and AMSA's reproductive health liaison to the Board of Trustees. Unfortunately, my co-moderator, Summer, was unable to join us due to a family emergency, but I want to thank all of the panelists for coming and all of you for joining us on this really important discussion. We have some great questions to start with. But for any additional questions that come up during this time, please feel free to put it in the chat here. We will get to as many questions as we can. And with that, thank you all, and let's get started. So if we could take just 5 minutes for each of the panelists to introduce themselves and tell us a little bit what they're currently working on. We can start with Dr. Thibaert.
Thank you so much. Thank you so much. My name is Kelly Thibaert. My pronouns are she, her. I'm currently living and practicing in the state of Florida. I'm a family medicine physician, so I'm doing that ambulatory care only, Monday through Friday, and on the weekends I travel around the state and provide abortion care here. Aside from that, I am, as Rohini mentioned before, a past national president of AMSA from 2016 to 2017, where we really started to hone in on and focus on abortion care and reproductive justice. And I currently serve as the AMSA Foundation board chair and president, where we continue our focus on reproductive justice and intersectionalities of different various types of oppression of our patients. And so currently other things I'm working on aside from working with AMSA is working on rallying folks within the state of Florida. We just finished legislative session, and so really working on some grassroots initiatives here and working with people from a lot of these great organizations who are being represented here, but on a state level. And so I'm very excited and very honored to be in the same space as my colleagues here and to be able to talk with you all and answer some great questions and to continue the fight for reproductive justice. I won't take 5 minutes, so I'm going to turn the time over to my other friends here.
Thank you so much. And then Dr. Brandy.
Sure. Hi, everyone. Thanks for joining us today. My name is Dr. Kristen Brandy, and my pronouns are she, her, aya. I have a lot of hats. Currently, I work at the American College of Obstetricians and Gynecologists, or ACOG, as what they call the Darney Landy Fellow, which essentially I serve as the in-house abortion policy guru. So I do a lot of different things there, including helping write clinical guidance. I help with some of their media and advocacy work, do some things with policy, looking over things that we get from legislators. So a whole bunch of different things. In addition to that, I'm also a run-of-the-mill OBGYN and complex family planning subspecialist. I provide abortion care in New Jersey when I'm not in DC. I also work with Physicians for I can't talk today. Physicians for Reproductive Health. I'm still their board chair. I'm not passed yet, but I will be soon. And so we, on that perspective, doing a lot of advocacy media work, testimony work, just trying to get the word out about abortion on a national level and trying to bring more people into this kind of training to learn how to advocate on behalf of the communities we serve. I also am part of Circle FP, which is a non-hierarchical anti-racist group within family planning that tries to work on dismantling racism and other oppressions in clinical care, research, education spaces within family planning work. And I'm lucky to help with some of the AMSA programming and the Repro Health programming. So I think that's it. I'll turn it over to other people.
Wonderful. Thank you so much. And then Lauren.
Thanks, Anna. Hi, everybody. I'm really honored to be here to speak with you tonight. My name is Lauren Polk. I use she, her pronouns. I'm Senior Research Counsel at If When How, Lawyering for Reproductive Justice. And the main thing that I focus on in my work, though it's not the only thing, is self-managed abortion. And specifically, I talk to medical providers about self-managed abortion. I often am co-speaking with doctors, sometimes with the folks on this panel, to talk about self-managed abortion, because we want everybody to know that self-managed abortion as it stands now, particularly self-managed abortion with pills, is safe, and that is medically safe, and that the risks are mostly legal, right? And so I talk to healthcare providers about those legal risks and help them understand what their patients are facing when they're coming in, et cetera. So yeah, it's wonderful work, and I'm glad to be here to share a little bit about it.
Wonderful. And we are so excited to hear about it. And then last but not least, Amber.
Hi, everyone, and thank you so much, Anna and Rohini, for putting this together, and to AMSA for having us all here for this interesting conversation this evening. So I'm Amber Khan. I use she, her pronouns. I work with the Lawyering Project. The Lawyering Project is it's a nonprofit legal organization that broadly works to challenge laws that undermine people's rights to access reproductive health care and their reproductive rights in general. And so we do this work in a couple of different ways. We do it through litigation by challenging some of these laws in court, as well as the Access and Innovation Program, which is what I focus on, which is really working directly with providers and supporters and abortion funds to do things that are a bit similar to what Lauren had also said, to really help folks understand the legal landscape. It's constantly changing and can be quite scary, so that people can, understand what they can and cannot do, and really figure out the best ways to continue to work with their patients and provide the care that's so important. So I'm really excited to be here, and thanks again.
Well, thank you all so much. Again, we just can't thank you enough. We're so excited for this conversation. So we'll start off with some questions. The first one is for you, Amber. So there's a lot of confusion in the current legal environment on abortion access, both federally and state by state. Can you explain to us where we stand on mifepristone, one of the two pills used in medication abortion, and where that stands currently in the courts today?
Yes, it is definitely confusing with all of the cases that keep going up and down through the federal system. So, first off, and I think everyone knows this, but generally speaking, regarding federal and state laws, after the Dobbs decision in 2022, the issue of abortion was returned for the most part to the states, meaning that there's no federal protection for a person's constitutional right to access abortion care. And so states really regulate abortion care in a lot of different ways. Some states have constitutions that are really protective regarding patients' rights and access to care and privacy. Other states, unfortunately, are not and have really restricted access, banned it, just done all kinds of things across the board. So it varies a great deal. Then another thing that really started happening this year and this spring, we've had a couple of different court cases and court rulings about, is the status of mifepristone, which is one of the two medications that's commonly used with misoprostol in medication abortion. And so what that litigation is really about and how it started is regarding the FDA, or the Food and Drug Administration, and their approval of mifepristone, which was initially done in the year 2000. And then after that has been expanded and has new provisions and different things regarding its details of who can prescribe it, until when it can be prescribed, whether it has to be in person, etc. So things have been expanded regarding mifepristone over the past, almost 23 years since it was initially approved. So the litigation. So what happened there? And it's still ongoing, I should say. But in Texas, there was a case and a ruling that came out this April in a case called Alliance for Hippocratic Medicine versus the FDA, where a group of physicians and medical associations challenged the FDA approval of mifepristone, the initial approval that happened back in 2000, as well as the subsequent changes and expansions regarding the use of that medication. They argued a bunch of different things, everything from it should never have been approved to begin with, to it violates other types of federal laws, to the federal government has ignored people's complaints, just a lot of different things across the board. And unfortunately, what the Texas court did is they issued a ruling in April, and the term is stayed. So they stayed the FDA's approval. What that means is they essentially turned the clock back to pre-2000, making the medication unapproved. However, then there was an appeal of that decision that went to a court of appeals in the Fifth Circuit. These are federal cases. And in that emergency appeal, what the Fifth Circuit said is that a portion of the Texas order could go into effect and a portion could not, just adding to the confusion. So what they said is that the 2000 approval, that would stand, but the changes that were made after 2000, including the fact that providers that are not physicians could prescribe it, or that it could be dispensed through pharmacies or through the mail, that cannot stand. So they also moved things around. Then those things went to the US Supreme Court, again on an emergency appeal. And what the US Supreme Court did is said that all of these lower court decisions, so the Texas decision as well as the Fifth Circuit decision, they're both stayed, meaning they're paused, until these cases are fully completed. So there's a couple of big things to remember from all of these different cases going up and down. The one big one is that as of now, the FDA status of mifepristone is exactly the same as before any of this litigation started, meaning it is approved medication. Providers who, under their state law, are able to prescribe medication abortion and use it as a part of their practice can continue to do so. The patients can continue to access it. And that includes using telemedicine or the mail, pharmacies, again, assuming the state law at issue allows it. So that's kind of a big thing to remember. The other thing is that we don't know in the long term what this is going to really look like and what this is really going to do with respect to the FDA approval, because now these cases have to be completely litigated in these underlying areas in Texas and potentially appeal to the Fifth Circuit, undoubtedly to go right back to the US Supreme Court. So we're not really going to know what the ultimate end is for a while, but for right now, it is the status quo. And I cannot repeat that enough. On a state level, so that's the federal level, right? That's the FDA approval of the medication. On a state level, it's just the fact that states just regulate abortion very, very differently. So some states allow medication abortion. Other states have specific rules about it regarding in-person treatment. Some states allow telemedicine, other states do not. So that part hasn't changed. It's still regulated really on a state-by-state basis. And so it's really specific to where the provider is and where the patient is. But on a federal level, it's status quo until the cases get fully decided regarding the FDA approval.
Thank you so much for breaking all of that down. It has just been a whirlwind to try to figure out what is happening. And it has caused so much confusion for patients, providers, everyone. So thank you for that. We will definitely turn to you all for more advice as things begin to proceed in the courts. Kind of along this lines, though, of confusion and medication abortion and mailing abortion pills was brought up a little bit. But Lauren, can you explain to us really where we stand on mailing of abortion pills, especially to states which ban abortions?
Yeah, so just a disclaimer, none of this is legal advice, all legal information. But I do want to say, I can't speak for the entire legal community, in part because there are a lot of different opinions on how to respond to the fact that mailing abortion pills or telemedicine abortion is banned in many states in the United States, right? So what I can say is that there are incredible groups like the Abortion Defense Network, which Amber's going to talk about a little bit later, I think, where providers can call to get a risk spectrum, right? To understand the spectrum of risk for engaging in any number of activities around abortion, including the provision of abortion pills to states where there is a telemedicine ban, because effectively doing so, right, in many cases would be civil disobedience. Active civil disobedience. And that is something that some providers are choosing to do. It's something that a lot of providers are really scared to do. Understandably, folks don't want to put very expensive medical licenses on the line unless they really, really understand what the risks can be. So really, I can't emphasize enough that, once you all are, for the folks who are medical providers or in training on the call, once you, are in your practice, it's really important to get legal advice about, what your risk is. So you can do a personal risk analysis for yourself about how you want to provide medical care. And that's not just abortion care, right? That's also, we're seeing a lot of restrictions on gender affirming care lately as well. And so it's really important that medical providers understand what their sort of spectrum of risk is for these activities, so that you can make a really informed decision about how you want to proceed with how you provide care to your patients. And another thing that I'll say is that, just to do a quick definitions moment. So when a licensed provider provides care, telemedicine care, or any kind of care, right, within the bounds of the law to a patient, that is a clinical abortion or a telemedicine abortion, right? It's something that is different from what I talk about, which is a self-managed abortion. So self-managed abortion is when folks are engaging in an abortion that's outside the bounds of the formal medical system, right? So it may not be against the law, right, in certain circumstances, but it might live in a legal gray area. And people use a variety of methods to self-manage their abortion. One of the most common ones is abortion pills, which is what we've been talking about today, right? So the fact that those pills are being more and more regulated and folks are trying to sort of regulate them out of existence, it really matters for self-managed abortion as well. Other folks use other methods, botanicals, methods of massage, right? Sometimes folks use unsafe methods to self-manage an abortion, but If When How's position is that no one should be criminalized for their pregnancy outcome, regardless of what method of abortion they might choose, right? And the reason that I say this is because we know that people are being criminalized and have been criminalized for their pregnancy outcomes. So my colleague Laura Huss did a study that said that between the year 2000 and the year 2020, there were 61 cases of people being criminalized for either alleged or actual self-managed abortions. So we try to share that number because there shouldn't even be one, right? There shouldn't even be one. But the fact that there are 61, and those are only the ones we know about, right? So we've done all the combing that we can, but I'm sure that there are instances of criminalization that slip through the cracks that we have not been able to see. And obviously, criminalization affects different people differently, right? And the folks who are most likely likely to be criminalized are folks who already are holding a lot of marginalized or oppressed identities, right? That are more likely, for example, to be heavily policed, that are more likely to have their healthcare provider, report on them, right? So that's actually, we know that of those 61 cases, about 45% came to the attention of police because a healthcare provider reported their patient to the police. And that's why I do what I do, because I really want providers to understand that that's not only not necessary or not required under the law, it's wrong. And so, I want to make sure that we really get the word out that there's really no reason for a medical provider to be reporting a self-managed abortion to the police. And we can really, as a community, help stop criminalization before it starts by ensuring that folks are, protected from that kind of behavior. So I hope that I somewhat answered your question, and I went in circles a little bit, but I hope that was useful.
That was wonderful. Thank you so much. You brought up such important points. And I think it also really emphasizes why things like this, where lawyers, medical professionals, law students, med students start to talk to each other, because there are a lot of confusion that with reporting and just in general with reproductive health, and especially where things are going. So, so important. Thank you. In keeping with this theme of confusion, Dr. Brandy, have you seen changes in patients requesting abortion, even in states where it's legal, because no one quite understands what the legal environment is?
Absolutely. And really sadly, it has been a really confusing time. I'm thankful for the lawyers on this call that have made things a little bit more clear. But as you can imagine, many of the people that are providing medical care don't have legal degrees. And so we're trying to navigate this not as a theoretical conversation about rights, but what is actually on the ground? What does my patient in front of me need right then and there? And that has been a really big challenge for patients and for providers. From the patient perspective, I practice in New Jersey, a place that has a lot of protections, luckily, around abortion care. And we've even seen lots of confusion in the patients that I see about whether or not medication abortion is still accessible. What is the status of mifepristone? Or people were calling in advance of all of these decisions saying, can I be seen earlier? Because I really want to make sure I get this medication before it becomes illegal. Which is not the thing that was happening, but that's what people heard in the news with all these snippets of things. With the Dobbs decision, we heard calls about, can we still get abortions in the state of New Jersey, even though it was legal? Because there's just people hear kind of little bits and pieces of what's in the media and don't necessarily know how that translates into the healthcare that they need. And providers too, providers are just trying to figure it out and talk to our lawyer friends and our policy friends to figure out what all this stuff means. But on a day-to-day basis, it's us trying to figure out, all right, our clinic opens at 8 a.m. The Supreme Court's going to weigh in on this at midnight, potentially. How is this going to impact my first patient at 7 in the morning that I have to take care of? So it's been a lot of confusion and chaos and trying to figure things out so we can make sure that patients get care. And that's the whole point. The whole point of all of this is just at the base level to confuse people, let alone actually restrict people's rights and ability to access care. So we're doing the best we can. And I think physicians, part of our role is just speaking out and just making sure people understand what's the actual reality of what's going on, both explaining this confusion, sharing these stories, but also just dispelling this information, making sure people know that medication abortion is safe in the case of mifepristone. If you actually read the legal document that came out of the Texas ruling, it's awful. There's so much misinformation in there, on top of it just being really rude to both patients and providers of abortion care. So a lot of the job is just kind of dispelling myths, making sure people know what is actual fact right now versus all the fiction that exists in the media.
Absolutely. Thank you so much. And so in going along with that, Dr. Tibbert, you practice in Florida. which is a state that hasn't been super friendly to abortion seekers and abortion providers. And a lot of these restrictions on abortion that have popped up are provider facing, threatening to doctors with prosecution or even fines. Have these laws and how have they changed your medical practice in Florida, your colleagues' medical practices in Florida? And how do people understand their legal protections?
Sorry. Thanks so much for that question. You're definitely right in that it has been, to go with the theme of confusing, right? Like confusing for patients, but also for docs and just providers in general here, never knowing what the legal risk actually is from day to day until, you know, policies are actually passed. We're seeing with different types of healthcare too, such as gender affirming healthcare, not having policies in place, but having our boards of medicine seeking out to harm us for providing certain types of care. And although it's not a policy, many people listening to that, because one of the retributions could be your license being taken away and that being your livelihood, right? So while you might not be prosecuted, you could lose your source of income and ability to live in the state, right? And to practice what you've gone to school so long for to do and to care for patients. So has it impacted our care? Absolutely. As you can imagine, there are a lot of doctors and providers who are nervous to continue to provide care. From the abortion care perspective, I've seen several colleagues stop providing care. I've seen some folks move out of state, of course. Even from the gender affirming healthcare perspective, I've seen many places shut down their large gender affirming care clinics, and I've had a great influx of patients into my practice, which is not as large as those other practices. So it's impacted my patient panel size, my ability to care for my patients who are not seeking gender affirming healthcare, and needing to really navigate how to do that, you know, and whether that's seeing patients after hours, seeing patients through lunch, making sure you get people on a call list to get them in as soon as possible, because you want them to be able to get care before this certain deadline meets. That's not the way we should be practicing medicine, right? Like medicine needs to be practice that is evidence-based and based off of what people and patients need for their healthcare and for them to live the healthiest lives that they can achieve. We shouldn't be practicing based on deadlines or out of fear, and just like waiting for the other shoe to drop, which I feel like a lot of us are doing in this time. I don't think a lot of docs or providers know their legal risks or even of the resources that are going to be talked about here a little bit later. But one of the great things is that we have these groups in this community. Like this is the way that I stay in touch with what I can do. And I rely on my colleagues and their expertise. You know, similar to how I've gone to medical school and gone through my training to be a physician, you know, you wouldn't trust somebody who hasn't done that. I don't trust other people who haven't been to law school and are actively practicing law to give me my advice too. So looking to the folks who are, you know, are legitimate experts on those things. One thing I've seen that's different in just practice in general is that I spend a lot more time educating patients on health policy than I do even on like the health at this point, right? Like the health is just like, great, like we know how to do this. This is bread and butter. I know what we're talking about. But when they ask me the questions of like, when can I expect to stop receiving XYZ care? Or when's the last time that I can get in for this? And a lot of times my answer is, I don't know. Like it depends on when this policy is signed. It depends on when our state Supreme Court meets to discuss this particular issue. It depends on what things are going to come out of this next upcoming session in a few months here, right? Like that's really hard to do. So I think arming patients in our communities with the resources that the folks here on the call work for and with is really important. And then just letting them know about alternative and additional resources that they can look to that are safe, that are evidence-based so that they can stay in the loop as well. Because at this point, it's not enough for patients to just know and trust their physician. They need to know and trust their folks with legal advice too, because the policies impact their healthcare so much. So I'll leave it there.
Absolutely. And that is the perfect segue to our next question for Amber. So this is about the Abortion Defense Network. If you could talk a little bit about what it is, how it was formed, and how it works.
Of course. It really was the perfect segue to that question. So, as I think, unfortunately, we all know the human right to access care, including abortion care, has been under attack for some time. However, I think as, Dr. Brandy and Thiebert have both pointed out, after the Dobbs decision, not only are there more restrictive laws at issue, but there's an effort to create this confusion and this fear. And so the need to have something like the Abortion Defense Network really came out of this timing. And so what the Abortion Defense Network is a collaborative effort by nonprofit organizations, private law firms, and government officials. It's managed by the Lawyering Project in partnership with the ACLU, the Center for Reproductive Rights, If One How, the National Women's Law Center, and Resources for Abortion Delivery, or RAD. And what it does is connect abortion providers and supporters to legal resources. So it connects folks to attorneys, values-aligned attorneys, who can provide this risk assessment or even representation as it's needed by providers, funds, supporters, whomever contacts the ADN. The Abortion Defense Network has a website. I can drop the link in a chat if it's easier, but there's a pretty easy, form that one can fill out if one is looking for support or to be connected with legal advice. You can also call us and, we can send you to our colleagues to, be able to understand what the need is and see if there is a good fit for a legal organization to connect you with, who can provide you the specific type of information. Because as, I think we've all said, a lot of this confusion is also because things are different in different parts of the country. And so it can help to speak directly with a lawyer and get a really specific assessment of what's going on. So the provider or the fund or, whoever it is that needs help can really have an understanding of not just the law, but the way it's changing and what risks they do or do not want to take, what they're comfortable with, and how to do all of those things in a way that not only means they can meet their professional obligations and their ethical obligations, but really, meet the care that the patients need, and ensure that all folks kind of feel protected and safe in the way that they're doing it. So that's essentially how the network is set up, and it's there, and there's lots of great attorneys and organizations that are eager to help as many folks as we can.
Oh, thank you so much. Such an important resource. And Lauren, if you could speak a little bit also about another resource that's available, that would be wonderful.
Yeah, so I just want to shout out the Reaper Legal Helpline. We work in conjunction with the Abortion Defense Network. We're linked on the main page, right? But the Legal Helpline is for patients, really. So it's a place where you can send your patients, abortion seekers, and folks who are not medical providers who are helping abortion seekers as well might call to Helpline to get more information about the legal rights and risks around self-managed abortion. We have a great FAQ on the website that just generally talks about some of the things that people might be concerned about around self-managed abortion. And then in addition, I do technical assistance directly for providers who are worried about the reporting aspects around self-managed abortion. So for example, I had a provider in Ohio who was a licensed family therapist, and her boss told her that once abortion was banned in Ohio, that she couldn't talk about it with clients anymore, and that if she did, that the clients she had to report the clients to the police. So it was like, there are some wild interpretations out there also about sort of how the law works, and what it means whenever an abortion ban passes, not only for self-managed abortion and discussions of self-managed abortion, but also for abortion that is done in a formal medical setting. Pro Legal Helpline, it's reprolegalhelpline.org. There's also a phone number people can text. They can send an anonymous email. It works much the same way as the Abortion Defense Network, but just for abortion seekers.
Unfortunately, we are in a climate that we need these platforms, but fortunately, we have folks like you all who are really doing this, and this is so important because it is very confusing, and there are pros and cons that we all have to really think about. And we need to understand really what is our risk, what is our patient's risk, what in general. So thank you all so much. Now I'm going to segue over to medical training. So Dr. Brandy, the restrictions in abortion care are continually and dramatically impacting our medical training. There are a lot of medical students on this call and pre-med students and residents who are looking to get involved in abortion care. But there are a lot of residency programs that are no longer providing that care. And even in medical school training, there are a lot of schools that don't even mention abortion care. Do you have any advice for future providers who are looking at residency programs, especially OB-GYN, say, residency programs?
Sure, thanks for that. And I think before I joined ACOG, I was working at a medical school, and a lot of my job was mentoring people that wanted to go into reproductive health care fields and help them through the process of applying for residency. And the past couple of years have been really rough. I think, particularly in OB, for the first time ever, like there was a huge number of people that went unmatched 2 years ago. So that was already distressing and people were already worried. And then Dobbs happened. So it's been really stressful for people in like second through fourth year of medical school, the past couple of years, trying to figure out what to do. I will say that there's been a lot of work behind the scenes to make sure that care is interrupted. And I should say, like, in the ideal situation, already abortion training has been not so great across the country. I think it's about 40 to 50% of medical schools have some type of formal abortion training. So we're already not starting so great. But a lot of programs have been trying to do different ways to get that training that people need, either exchange programs where a residency that is in a state where abortion is illegal will send a resident off to another state for about a month to get training and have one of their residents come train with them. Not only just kind of send people out to places that get training, but also that people in places that have abortion training can get other training that they may not have in their own site. So trying to make it mutually beneficial for those residents. And there's been a lot of conversations about simulations. There's currently something that ACOG and other groups are working on to create like a mandatory simulation program for all people for OBGYNs. So that even if you don't get training, like you are still required to get some of the basic core competencies about abortion. So that way we're making sure that everyone gets some form of training, even if it's not direct clinical care. I would tell anyone that's thinking about applying to OB to not give up. It's really frustrating. I can tell you firsthand that it's been a long road and it's really tough, but I wouldn't trade it for anything. There's no other job I would do. I love the work that I do. And so that makes it meaningful enough to keep going. And I encourage people, like, if this is your passion, do it. And we need more people to be doing this work. So we'll figure it out. But I think the most important thing is people are applying to ask questions. Don't be afraid to talk about abortion during your interviews, even if you're in a place that you think that you're not going to get a good answer or that people will rank you lower because of your question about abortion. One, they're not going to remember your questions for the most part. And two, if you ask a question about abortion and they give you a lukewarm answer, or they frankly, tell you that's not something that we do here or encourage here or whatever, then you don't want to be there. So it's better to just ask the question and get a better sense of what's going on than be in the dark and match somewhere that doesn't have the training that you need to be a competent physician. So.
Absolutely. And Dr. Tibbert, especially, do you have anything else to add to that, especially from the family medicine side?
I definitely second all of what Dr. Brandy has just said, because a lot of it really applies to family medicine too. I will say another thing you might come up against in family medicine is that because we don't have a core competency of needing to do miscarriage management or provide abortion care, you might be a little harder pressed to find places where they say that that's a part of their curriculum, because it's not a requirement of our family medicine residency core competencies. Should it be? Absolutely, it should be. Family medicine doctors are a great portion of providers who offer abortion care, both within our primary care clinics and then also in outside clinics and in independent clinics. And I think that's something that is really important. You know, I know OB-GYN and family medicine both fall under the primary care umbrella, and patients feel so much better supported when they have their primary doctor, the one who knows them, providing their abortion care and their comprehensive reproductive health care. You know them as more than just that patient, and that's what they're there for, and that's what they like, right? Like, we want to provide that care. I think that making sure that you're connecting with the right people and networks is really important. So for instance, AMSA, right? Like our reproductive healthcare programming, there's a lot of opportunities to learn, whether via simulation or with like our Papaya workshops in person or virtually, as we've done throughout the pandemic. Same with a lot of other organizations, right? A lot of you have probably heard of Med Students for Choice, MSFC, and there are many more that are doing a lot of great work like that. I would say get involved in these organizations, get to meet the people who are also pursuing the same training, but then also the people who are giving the talks and like being the attending physicians and like people who are there who can make that connection with you. That's honestly a large part of the way that I made my connection to get the training that I needed, because it was something really hard for me to find throughout my training career. Even though I voiced it at every step of the way. And so having those connections to people and groups who want to see you succeed in something that's a necessary part of healthcare, I think is going to be a really important thing for us to do together. And I will also second Dr. Brandy in saying, like, we're here and we need and want more people. And I won't speak for Dr. Brandy, but I will say, if anybody wants to like reach out and talk and pick my brain, looks like Dr. Brandy says yes to her brain too. You know, reach out. We're happy to get you connected and get you involved in the work, because we want to be there to support you.
Thank you both so much. I just love that so much. And for our lawyers here too, Lauren, what advice do you give future lawyers to get involved in reproductive justice?
Yeah, I mean, I think sort of echoing a lot of what Dr. Brandy said, to find a way to do your heart's work, right? Like, even if you can only do it for a few hours a week, volunteering on the side, because you need, you know, a different type of job for other reasons, right? Just find a way to make that a part of your life. I don't think that you'll regret it. I think that one of the things that is so wonderful about reproductive justice as a practice, as a framework, is that you can take it with you anywhere. So if you really dream of being a housing attorney, take reproductive justice into your housing law work. I promise you it's there. You know, immigration attorneys, take reproductive justice into your immigration work. You know, I think that there's so many things. I mean, we work with a ton of law firms right now, right, who have folks who are normally doing like corporate tax law, and they're like, please give us something that we, you know, that we really care about, that we can work on. So I think that there's really a variety of ways to take this lens and apply it to whatever you do. But additionally, I think that just if you do want to get involved in the movement, it's really great to get experience however you can, whether that's volunteering, whether it's an internship. You know, there are a variety of ways to really, I think, get prepared to come and be a part of the movement in whatever way works for you. I have lots of former interns that are now professors, or, you know, doing other types of jobs where they have taken that lens with them. And I just, it it fills my heart to be able to get to watch them go off and do their work with this lens.
Yeah, I love that. Thank you so much. And Amber, so there are both law students and medical students again on this call. And I think a lot about how lawyers and medical professionals work together, especially when they're so intertwined. But it seems like we tend to work in these silos where it can be really hard to for everyday providers to, without being involved in things like this, to find legal representation or even someone just to ask a question about. So how do lawyers and medical providers get connected now, and how do you think we can do a better job in the future?
That's a great question. So I think, events like today's, for example, is a great way of doing it. I think we have to not only be committed to speaking to each other, right, in our silos and just kind of preaching to the choir, but, as an attorney, I've spoken at medical schools, I've done grand rounds, I've also spoken to judges and other, legal conferences, but I think we have to find ways to kind of work together, including in situations like this, where there's doctors and lawyers and providers and advocates together kind of speaking about the issues that we have in common. Because one thing that I've found throughout my work is that medical providers and healthcare providers have incredible strength actually in their voice that is relevant in policy and in law. I mean, there is a strength to it. There is a power to it. A lawyer can make a particular argument. We were talking about mifepristone earlier, and the lawyers involved have made a lot of ridiculous arguments in that case, as Dr. Brandy has pointed out. But the power comes from, providers themselves speaking about it and saying, this medication has been safe for 20 plus years. I've been using it. They have the experiences of their patients that they can bring to that story. And really, it's a true narrative of what someone's experience was, especially as patients often may not be in a position to be comfortable to share their own experience. But, doctors especially hold a space in society where people do want to listen to them and do want to give them credit for what they're saying. And so I think ways that we come together through these panels or discussions or meeting with each other is really powerful, because I think there's a lot of strength in the voices that medical providers bring to this conversation.
That's wonderful. Thank you so much. And I know that we're almost running out of time here, but I do want to end on a little bit of a positive note here. So this is for Dr. Brandy. It can be easy to focus on a lot of the terrible things that are happening right now in reproductive health care and all the confusion. But I do want to talk about a win with Opill, which is on track to be the first over-the-counter birth control pill in the US. Dr. Brandy, you gave testimony on behalf of ACOG at the FDA hearing recently. How did it feel to have the FDA advisory committee vote unanimously to recommend the approval, and what comes next?
It was cool. I'll say that personally, to give testimony in front of the FDA was fun. And I think it goes to Amber's point about how I think doctors generally are just so worked up or so caught up in our work that we often don't recognize how much power we have in the voices that we have. And so I would second all of that we should be speaking out and consider, as pre-med, as medical people, how can you potentially speak out on behalf of the communities you serve? And this is one opportunity to be able to talk about how birth control is life-changing and life-saving for a lot of people. And hopefully the FDA will see that too. So as far as process, the FDA had an advisory committee that unanimously voted to approve this medication for over-the-counter use. It now goes to the FDA. I'm cautiously optimistic. We will see. I'm a little concerned because they had lots of weird questions about, can people follow the rules on the pill box and, follow it appropriately? Or can teenagers do that? So there's some questions that were a little troubling. So I'm hopeful that they will look at the evidence and see that it is safe and that people should get it over the counter. But it was nice. I feel like as you mentioned, like it's been a long road. I think the past couple of years have been particularly challenging for people in this repro health rights justice space. And so I'll take all the wins we can get. This was a good one for now. I hope it keeps going, and I hope some of the other things are turning our way. And it's good to know that there are more people on our side, that abortion is a election winning issue. It is something that the vast majority of people support. And so we just have to keep remembering that and keep pushing forward and hopefully getting to a better place.
That is a wonderful place to end. Thank you all so much. Are there any last minute questions before we let our lovely panelists go? We'll just see in the chat. We'll give it a minute in the chat here. Well, I think there might not be any, but please feel free to send us any questions that you have later on or anything like that. Again, we thank you all so much. And I know we have Rohini here is going to present one last thing to everyone if you want to stick around. Otherwise, the panelists, thank you all so much.
Yeah, thank you so much, panelists, for all of you for giving us more clarity on what legal restrictions exist for abortion care providers, how to dispel these myths around these very legal complexities, and to push for abortion care training in undergraduate as well as graduate medical education. Again, it's such a great session. Definitely left me feeling very energized to advocate strongly for abortion care. Please remember that if you want to continue to learn, network with like-minded individuals, learn from experts and innovators, and be empowered, come to Future Physicians for Change. This is our annual convention. This year it's occurring in Phoenix, Arizona from June 15th to 17th. And one of our Advocacy Day priorities is to protect abortion care access. So we'll be talking a lot more about this. We'll be having lots of tangible action discussion items. We want to make an impact, and we want to see all of you there helping us make this impact. I'll just leave a how to register form right here. And oh, there it is. It's there. Anna put that in chat. So please check out our website and register. I really hope to see you guys there. Today is the last day for early bird registration.